Hi, y'all. I just wanted to get on today and talk about a discussion that I had with a good friend of mine here locally that has had a lot of experience in processing and healing her traumas that she's had. And I talk a lot about this experience of somatic experiencing and how I personally have seen it in my clients and heard through other practitioners about how that particular somatic modality, as well as others, even breath work, how it can be um, more of a traumatic experience for people than a healing experience, how it dysregulates their nervous system, and how it might trauma bond them to their practitioners and their therapists. And it's a real issue. So I'm continuing the conversation about it. And my friend and I were talking, and she was telling me her experience, and I just started having some revelations about trauma-informed care. And, we call it trauma-informed care. So, we're trying to understand how trauma affects the body. But a lot of practitioners that haven't experienced significant traumatic issues, or mainly maybe even that have, but their nervous system's developed in a healthy environment, they don't really understand what their clients are going through when they're guiding them through these somatic disciplines and treatment theories and therapies. And that can be a real problem because they don't understand that nervous system that they're interacting with is getting dysregulated and isn't resilient enough to handle the flow of energy that those somatic therapies create. So in my practice, I work with aligning and balancing the nervous system, usually in 1 to 5 sessions with clients. And then after those initial 5 sessions, they are more primed, if you will, to engage and interact with other somatic therapies, especially for the people that have high ACEs scores, which is adverse childhood experiences. Those people we need to be extra gingerly with and respect what their nervous systems might be experiencing even more than others that we might be practicing with and helping guide through their healing process. So as practitioners, it's really important. And unfortunately, a lot of people get into practicing trauma therapy and being guides for people to do their own healing before they're necessarily healed themselves of certain things that they've dealt with. And that can be an issue too, because you want to be healed to a certain extent to where you can really understand what someone's going through, and then also bring them that wisdom and help guide them from a place of regulation. So that takes a process. And if you're a trauma therapist, somatic therapist, manual therapist, massage therapist, talk therapist that has had your own experiences that you're healing through, it's really important that before you start working with people to heal with them and help them heal, that you do the work on yourself first. And if you can get through to a point where you can really educate yourself and come through your healing journey and then be present for others, that's a really powerful place, because you then really understand what people are dealing with when they're coming to you. And you understand to look for those codependent patternings, the kind of power over paradigm that can be brought through in some of these therapies, like somatic experiencing in particular. And you can become aware on a greater, deeper level of the extent of that and how that might be impacting people. So I see a lot of my clients and a lot of people that I talk to on the internet, on Instagram, about this, and they are saying that it really resonates with them. And people in the BIPOC community, people in the LGBTQ community that have gone through these therapies to help heal traumas that they've experienced. And talking with me, they feel like there's been words to put towards what they were feeling, and that it was traumatic for them, that healing process that was initiated possibly before their nervous systems were ready for it. So that's not something that people talk about. And we can even extend it into psychedelic therapies and, psilocybin assisted therapies, because that creates a flow of energy too. And just those toxins in particular can also disrupt the physical body system and the anatomy, to where then it impacts the flow of energy through the nervous system, mainly the liver, and can really create a situation where people are re-triggered when they shouldn't be. And it can create a situation too where even people in that traumatic state that they're processing through go to these therapies like psilocybin assisted therapy or other psychedelic therapies, and somatic experiencing or certain manual therapies, or even something we think is as gentle as breath work can be really traumatic and triggering for people. But people will go and seek those out, and it almost becomes like a drug seeking behavior experience for them, where they need that dysregulation and that hormonal imbalance, because they're not in a place where they realize that healing doesn't have to be traumatic or scary or like overly emotional. It can be gentle. Your nervous system and your body can just integrate what you've experienced. It doesn't have to release it. It doesn't have to let it go. It needs to integrate it. A higher perspective and a deeper level of healing is integrating your shadow. And that's just exactly what this is. You're never going to be able to completely release what you've experienced. It's part of your experience. But what you want to focus on is integrating that experience into your system so it doesn't become disruptive, so it doesn't cause more autonomic dysfunction or physical or emotional or mental illness. Integrating all of that is something that is that's where the power is, and that comes from self-sovereign power. You yourself are responsible for that. You're not looking for someone, another provider, practitioner, to help guide you through anything. You are occupying yourself. You're contributing to your nervous system's balance, and you're able to cultivate really true resilience. It does take a little bit of guidance from others, physical, energetic, just your experience that you're having, potentially to create an awareness, either a cognitive awareness through talking, or an experiential awareness through aligning the energy centers of the body and the nervous system of the body, releasing restrictions in the viscera to help get that flow of energy able to be moving within your body so you can integrate and you can self-regulate. But it's not something that you are necessarily dependent on another provider for. I usually work with clients in 1 to 5 sessions, maybe 7 max. In exceptional cases, we go to 10 when we're dealing with some kind of really deep-rooted emotional or physical experience, or as we're working, other things evolve and come up to the surface that need to be dealt with and have their own 5-session awareness and appreciation for. So, but it's not something that's ongoing forever. Transformation can happen, and it can happen swiftly. It all depends on your innate and cultivated resilience and your autonomic nervous system and how resilient that is. So we as practitioners need to be looking at ACEs scores. We need to be doing more in-depth interviews and intakes with our clients. And we need to be treating them from a trauma-integrated place in our practice, not trauma-informed. It's not enough to be trauma-informed anymore. We need to be trauma-inspired, and we need to treat people from a practice that integrates the trauma. So trauma-integrated therapy is what I'm going to be promoting from now on. Trauma-integrated therapy inspired by trauma, not just trauma-informed. That's not enough. Thank you for listening. If you'd like more information about my practice, about the courses that I teach, about the book that I wrote and illustrated that describes how energy and the spirit moves through the body, you are welcome to come to my website, elementaladvanced.com. You're welcome to visit me on Instagram, elemental.advanced. And if you're a client and you'd like to book a coaching session or one-to-one session, or if you're a practitioner and you want to book courses or a mentorship program with me, you're welcome to come to elementaladvanced.com or elementaladvancedmt for manualtherapy.com. And I look forward to working with you in the future and continuing this conversation. Comment below if something resonated with you or if you would like to interact at all. I'd love to hear from you. Thanks and have a great day.